Hi, you might have seen the article called "When Your Therapist is Only a Click Away" in the New York Times on September 23, 2011. It even made the homepage of the New York Times website on September 25th, the Sunday edition. I've created this video for you to point to some of the issues that are only partially addressed in that article. Technology today is very exciting because it allows us to responsibly deliver very needed services to people who otherwise would not get our help. Unfortunately, a large number of mental health professionals have not been heeding their legal and ethical codes, or possibly don't understand their codes, and they've begun practicing online without thinking through the serious issues that could thwart their good intention. Good intention can be misinterpreted by consumers in particular, because this is a consumer article and it does talk about some of the technologies that are now possible, but frankly are being used in some rather alarming ways. I'm Dr. Marlene Maheu, and I've been involved in telehealth, that is the electronic delivery of healthcare, since 1994. I chaired the first task force to ever address telehealth at the American Psychological Association in 1995. I've since chaired or participated in over a dozen other task forces, committees, and study groups at the American Psychological Association, the American Telemedicine Association, the American Counseling Association, and other large professional associations. I've written 2 academic and professional books on this particular topic, and in 2009 started an institute devoted exclusively to educating professionals. I understand the difficulties that journalists have in trying to portray a fair amount of information in a short amount of space. Overall, the article was well balanced. It represented various points of view. Sometimes these articles need to be a little more exciting, and legal ethical issues just aren't all that exciting, especially in a consumer article. My concern was that the minimization of the role of legal and ethical limits can not only lead to consumers misunderstanding us and what we need to be doing, but then it might limit our own understanding of how we can operate and protect our patients. In fact, when using the right video conferencing technology, telehealth is proven safe and effective. Patient satisfaction is very high, and Medicare, Medicaid reimbursement is available within specified limits. That is only going to continue. Third-party carriers are mandated to pay for telemedicine, that is telehealth, in over 12 states now. It's not just an issue of jumping on the internet with somebody you know or don't know. There are many other things that need to be taken into account. But none of this is rocket science. It certainly is easy enough to understand and to learn. Public network systems such as Skype escape federal oversight by doing one simple thing. And Skype isn't alone in this. Google Talk does it, Oovoo does it, a number of these different companies. They just remain silent about HIPAA compliance. They just don't make a statement about their privacy and security in a way that ties them to the healthcare requirement, but by remaining mute, they are not under scrutiny for anything that goes wrong, because they never said they were of a quality that we need to have. Now the good news here, and there's a solution for all of these problems, and that's what's documented in the literature, but the solution is that there already exist robust, reliable, HIPAA-compliant systems that aren't free, but they're quite affordable online now. The second issue is that licensing laws require professionals to hold a valid license in the state of residence of the patient, not just where the therapist lives. And this is because licensing is mostly about consumer protection. When a consumer needs to file a complaint, they need to be able to go to a body that they recognize, and in most cases that's their own state. So the requirement is that we be either licensed or registered with the state of residence of the patient. Number 3, patients in the studies that you'll see are usually met in person first, which makes sense. They're assessed by a verified licensed professional who is either a general practitioner, a nurse, or another mental health professional, and then they're referred to us, or we get records from them, just as we do in our own brick and mortar practices. The patient is greeted by an administrative assistant who will give them paperwork for HIPAA compliance, or the intake form, possibly some early assessments. They oftentimes, if they're in a hospital setting, and a lot of times in the documented literature they are in a hospital setting, a nurse will take their vital signs, a physician will interview them, will then prescribe a course of treatment and then give an appropriate referral. So it's pretty important that we start to understand this and get it clear in our own minds that when we're dealing with consumers on the internet, nothing changes. We have to follow the protocols that are evolving in our own healthcare arena, and then we're just transporting that to the internet. But the internet only requires us to add some extra bells and whistles. Part of informed consent touches on issue number 5, and that is that emergency safeguards are in place. That's based on the consumer's geographic location. When practitioners are working remotely using technology, they are encouraged by large groups such as the American Telemedicine Association, and the association, the ATA, in fact, even has a guideline, a written guideline that you can get for free at the American Telemedicine Association website, which is americantelemed.org, that was produced by the special interest group for the tele-mental health practitioners. But it goes into some detail about how you can educate yourself about the consumer's resources in their own community. You call the fire department, call the police department, find out what else is available in their particular communities in terms of hospitals or halfway houses or whatever it is you might need for your particular patient. But those emergency safeguards need to be in place. Another part is getting the right information, and part of the informed consent document that has to do with the name and contact information for a family member and possibly another healthcare practitioner, so that you really do have some recourse if you can't contact your patient anymore, or if the connection breaks and you don't really know what's happening. Number 6 is that IT professionals are available for the calls that are documented in the literature. That means that the professionals help set up the stations, they help educate the patients, the practitioners, and they're available in case something goes wrong. So even on the platforms that you'll see on the internet, there are professionals that are available, and this is what you pay money for when you pay for a service that's a HIPAA-compliant service. IT professionals are available so that any time during your call, if that connection breaks, they can resurrect that connection very easily, oftentimes on your part just with a click of a mouse. Number 7, prior education is needed for both the consumer and the professional. And that's because for consumers, a lot of times they're distraught when they come to us. They may have some trouble thinking, they may be overly medicated, or maybe they need medication and they're just not getting it. So in the documented studies that we're reporting, what we're finding is there's usually an IT person that's made available to them to explain all of this, to sit them down at the station and to explain what to do. The newer internet-based platforms also have a very simple approach. And so it may not be like Skype, you just click a button and you're in. You know, they need passwords, they need some things to protect their privacy when they're talking with us. But still, there's a little bit of training that needs to go on with that. The other thing is that the professionals need a fair amount of training too. And it's not just in how to use technology. This training is needed to the point that professional education is required by our ethics codes for professionals who use any new technology in an emerging area. And video conferencing is definitely a new and emerging area. But above and beyond training in how to apply a particular technology to the work that we do, we also need to understand the clinical issues that arise because of and in connection to using the technology. For example, if you practice in email, the issues are different than if you practice using video conferencing. Obviously in email you don't see the patient. In video conferencing you not only see the patient, but you may see their home or wherever they are. You may see their environment and other people involved. So the clinical issues really do differ quite a bit. Therapists seeking professional training for online therapy, which is known in the scientific literature by a different term. Nowadays it's called telehealth. You might consider joining us here at the Institute. We offer over 36 credit hours in continuing education units for that program. So join us and join the 21st century with your practice online.